Today, Assistant Professor Dr. Nurul Hazirah Jaafar from Department of Nutrition Sciences, Kuliah of Allied Health Sciences, IIUM, to give her talk with the title, Picky Eater, Nutritional Overview and Management. Please welcome.
Thank you so much, Sister Fasiha, and the team for your invitation. And I'm very excited to share some of my knowledge on the picky eating management. Right. So let me just share my slide first. So is it clear now?
Yes, Doctor.
All right. Okay. So I will just begin on this. Yep. Picky eating. Sorry. Yes. All right. So these are some of the contents that I will be sharing. Yeah. I will share on the overview, the definition, the prevalence, and why is it a concern for us. Then I will move on to the categories of picky eaters related to from mild ranges to the severe food selectivity. Yeah, and I will share on how did we as a dietitian come up with the nutrition assessment and later come up with the nutrition diagnosis. And I will share some of the information or on nutrition management. Right. Can I just stop share that bit here? Sorry. Again. Okay. Sorry. All right. So let me just start with feeding difficulties. Yeah, feeding difficulties or feeding problems. Yeah, especially on food refusal is defined as children having electing to eat foods that share similar color or texture and limiting food group or a specific brand. So this fear of food or food refusal came from many factors, which includes this physiological impairments, hyper or hyposensitivity, some cognitive or behavioral issue, or they have some issues with GI disorder, as well as the reinforcement of inappropriate feeding behavior by the caregiver. So it somehow leads to this fear of food or food refusal and subsequently affect the children's health outcomes as well as parental anxiety and frustration, right? So there are many terms that describe feeding problems as a whole, like food aversion, food refusals, feeding problems. So this feeding problems has been illustrated in this diagram, of which it ranges from first the dislike of only one type of food to the having sensory integration disorder or avoidant restrictive food intake disorder. So the in-between categories, we have mild, moderate, and severe feeding problems. So those with mild feeding problems, or mild food selectivity, they normally presented to us in a normal, having normal nutritional status, because they have only, dislikes of few food groups and having a mild problematic mealtime. But however, these children, even though they presented to us in such a way that they have normal weight, normal height, yeah, but they may experience micronutrient deficiency because of the dislikeness of a few other food groups, right? But those who are in the category of moderate or severe feeding problems or food selectivity, yeah, they may have presented to us as having underweight and micronutrient deficiency because they refuse to eat several food groups due to having an issue or problems with food texture, color, smell, or they have certain preference, strong preference to certain brand. Yeah. Okay. So in the severe group, yeah, severe feeding problems, where they refuse to eat almost all food groups because of certain food texture or color, they presented some of them, yeah, most of them are presented to us with severely underweight, with significant micronutrient deficiency, and they need the food supplements for that. Right, so this is the first diagram illustrated the feeding problems categories. The second one is according to the Katzner, yeah, in 2015, they also organized the categories or level of food selectivity according to these three levels. First is the food neophobia. Yeah, second as having mild food selectivity, and the third one is having very high food selectivity. So how or what kind of characteristic, yeah, displayed in each of this level is that food neophobia is characterized as children as having too little variety of food. But this one, this category, as according to Kastner, mentioned that this is only the perception of the parents on their children as having too little variety of food. Right, but however, the food neophobia, yeah, according to the Kastner, is a natural stage of development where it reaches its peaks between 18 to 24 months year old. So according to Katzner, yeah, the new food begins to be accepted by the children, yeah, after repeated exposure. So this one is the class of food neophobia. Right. How about picky eaters, where does it sits in this level? It sits in the middle food selectivity, of which that picky eaters, yeah, despite many exposure to a diet or the food, their dietary repertoire is lesser or poorer than the normal children. Yeah, they develop normally, but somehow the mealtime behavior exhibit during the mealtime. Yeah, the tantrums or the refusal can cause conflicts, which somehow leads to food forcing and inappropriate behavior at mealtime. Okay, and the very last level of food selectivity is very high food selectivity, of which many of our children with autism, yeah, belongs to this level of food selectivity, and they are at higher risk of developing nutritional deficiency because their dietary are often limited to 10 to 15 foods or less than that. And their selectivity, yeah, may be due to food aversion or disorder of sensory modulation. So I'm sure many of the pediatricians and OT itself knows about food aversion and the sensory modulation on it. Okay. So going when we have known about who is what kind of picky levels of food selectivity and where does our picky eaters sits in, yeah, I would like to share on the prevalence of picky eating itself. So as of now, from the review by Cow HS 2018, yeah, they compiled several studies conducted looking into the prevalence of picky eating. Yep. As you can see here, the prevalence of picky eating is quite alarming. Yeah. If you see numbers like 50s, 54, it shows that indicates that almost half of that population, yep, or the study populations exhibit picky eating behavior. Okay, so if you see here, the studies are more or less conducted in the Western countries as well as the Eastern countries, yeah, Chinese mainly of that, right? So it ranges between 20% up to 60% of normal children exhibiting picky eating behavior. And that from this study, the author mentioned that toddlerhood and preschool age is the peak time for picky eating, but it can reduce. It can be reduced according to age, right? So other than that, other than the high prevalence of picky eating from the study, they also mentioned about the strong attributes of picky eaters. Yeah, among them are strong likeliness to certain food category. Yeah, having certain texture, smell, also taste. Yeah. The second one will be unwillingness to accept new food. Yeah, that is the known behavior or attributes of picky eaters. Yep. Third one would be low numbers of accepted food and food preference in their diet repertoire. Yeah. The fourth one will be unwilling to eat regular meal time. So many of the children that come to my clinics, yeah, I could see this pattern of not having a consistent meal time, right? And this somehow affect their dietary intake as well, their appetite, yeah, and their food hunger, punya stimulation. So other than that, yeah, this one is also a strong attributes of PE. Picky eaters refuse to eat fruits and vegetables, especially the vegetables, and likeliness towards sweet food. And the last one would be one of the interesting facts is that most of picky eaters, yeah, they have the habit of some of them, yeah, having excessive milk drinking. So that is why they do not eat at the main meals, right? So all of these attributes, yeah, mentioned by a review by Cow, not only presented in other countries, but as well as in our population. Okay, so how do we come out with an objective diagnosis or an objective category of picky eating? Is through our thorough nutrition assessment. So as you can see here, these are the list of assessment. These are the list of our nutrition care process in order for us to dictate ataupun come out with the diagnosis that these children are particularly having the attributes of picky eaters, and that it has affecting their dietary intake as well as food acceptance. So first and foremost, we often start our nutrition assessment with feeding history, looking at their developmental milestone. We have to know on their oral motor skills, whether or not their developmental is according to their age. Yeah, is to look at how is the children develop the cognitive development of them. Yeah. The second would be we will ask a bit on the complementary feeding, when they had started their complementary feeding, how they started the complementary feeding, one in terms of the food variation or food selection. A second would be on the portion of the food during the complementary feeding. And then we will further asked on the age where the picky eaters behavior starts. So this information is quite critical for us to know what leads or what makes the children exhibiting picky eaters, either from the physiological impairments atau from problems, or more on the behavioral factors, right? So we also ask on that, and then we specifically ask for the feeding issues and concern of the parents. So that is during the initial assessment, initial phase of assessment. Second, our main core business would be on the anthropometric, the weight, the height, the BMI, and where does this value sits on the growth charts, whether or not it is in the normal or it's going towards downward, towards the at risk of nutrition problems, Other than that, we would also look at the biochemical values, especially on micronutrient deficiencies, the iron level, indicative of anemia or not, so and so forth, right? And the last one, the second last would be on the dietary intake. This is also our core business, looking at the variation of diet, through 24-hour diet recall or food history or 3 days food recall, and we also will ask on the supplements, whether or not we're taking supplements or whether or not pediatrician prescribe them with supplements, especially those with low appetite, And then we also will ask on the therapeutic milk or nutrition balance milk like Pediasure, Nutrient Junior. Does these children are having this special milk in their diet or not? And as well as from this diet recall, food history, we came out with a diet diversity score. So basically, diet diversity score will tell you of the numbers of food group, the number of food group taken by these children. So diet diversity will give us a clear information on their food acceptance. So the maximum numbers of diet diversity score will be 20. And those with less than 5 to 8 scores, meaning to say that they only taking 5 to 8 food groups, they has exhibit some kind of low food scores on the food acceptance, right? We also will ask on the duration of meal. Why is it so important? Is that according to the many literatures and many studies looking into feeding a problem, they mention that if a children ate more than 30 minutes at one meal time, there must be some problems in it. It's either, for those who are having neurological impairment like cerebral palsy, maybe, so they have oral or swallowing problems that makes their duration of meals a bit longer. So other than that, it could be some behavioral problem or tantrums during the mealtime. So either they only play with the food, not taking up the food. So the duration of meal is quite also indicative of the red flags at mealtime. Okay. And I will also will ask about the mealtime situation. Where does the meal taken place? Who involved in the meal time? So meaning to say, that does the children eat alone or does the children eat with the family members? Does the food presented to the child specific to him, or does the children eat the family food? Okay, so this situation will provide you integrate you with what might be the problem of these children. Okay, we look objectively and subjectively into picky eatings. Right. So, and the last one, a more objective measurements of feeding behavior is through questionnaire. We have quite a list of questionnaire that could assess their feeding behavior, including CHEBI, CBQ, BPFAS, as well as PD8. So all of this questionnaire will provide you with the information and whether or not these children exhibit certain feeding problems, due to sensory, behavior, oral motor functions, or just the parents' perceptions. Okay, so taking this all into consideration, we really look in detail about the nutrition assessment of picky eaters. So in order for us to come up with a very suitable nutrition diagnosis, and more often for picky eaters, the nutrition diagnosis will either be the problem related to the inadequate oral intake or food acceptance. Okay, a limited food acceptance. So the limited food acceptance, we could relate to the diet diversity score in terms of the numbers of food group taken, and whereas for the inadequate oral intake, we're looking into the energy intake, looking into the protein and micronutrients intake, as evidenced by their weight gain as well as their current nutritional status. So those are the two things, ataupun two a common nutrition diagnosis for this picky eaters. Right. So when we have understand, in detail about their nutrition status, we came to the management. So basically for picky eaters, the caregiver of picky eaters, we will give a quite lengthy nutrition education program. But first and foremost, before we came into the feeding therapy or other therapies for picky eaters, we will emphasize back on the basic principle of eating for children, which involve these four main points. One, it should be according to the requirement. If the children is normally developed, the weight is normal, the height is normal, but no significant micronutrient deficiency detected. So it is according to the requirement by the Malaysian Recommended Nutrition Intake 2017. And if the children are presented with underweight or plateau weight gain, so we will provide a catch-up growth requirement for them, right? So the second one, we will also emphasize on having complete and balanced meal at each meal times. Meaning that at one sitting, they are having a complete and balanced meal in terms of carbohydrate. It should be, this food should consist of carbohydrate, protein, and fat, as well as the fiber in it. Okay, and we often offer recommendation based on the current food intake and what is available at home. Okay, this is quite essential ataupun quite crucial, because parents with picky eaters has already burdened by the stressful mealtime, right? So whenever we want to give the suggestion, it should be within what is available around them. Okay. The third one is for food variation. We really emphasize on trying quite numbers of food in one food group. Not only rice. We know that rice is our staple, right? But it's not that if the children does not like rice at their mealtime, they considered as abnormal. No, Yeah, because a carbohydrate group, they have other options like bread, pasta, noodles. So just be it, if the children does not like rice for certain issues, if they eat other sorts of carbo like bread, noodles, pasta, it should be okay. That is a good or normal, still a normal attitude toward food. Okay. So it is the parents or caregiver responsibility to introduce a variety or a selection of food at one food group. And the last one would be responsive feeding. It really the parenting style especially really influence their behavior and attitude at mealtime. Yeah? And the best parenting style when feeding is concerned is the authoritative parenting style, meaning to say that it has to be a two-way communication whereby we as a parents should dictate some of the rules at the mealtime, when should we eat the food, and what kind of food you should eat. But the children were given the say as well, yeah, to choose what they like to eat at the moment, or how much you want to eat at the moment. Yeah, so the negotiation is a must. Yeah, communication between these two is also a must. Yeah, but we need the discipline at mealtime, right? The second is set the rules to eat together with the family. Yep, negotiate types of food to be eaten, and we also must standardize or must put a discipline that the mealtime is not more than 30 minutes. Okay, we have certain times to eat, and the food should be finished within this time only, right? And serve food in attractive way or themes, yeah, sometimes because children being children, they like fun, they like to explore, so be it, yeah. We also as parents, we should also make have the effort to make the mealtime as an attractive time for them, right? And avoid feeding, buffet feeding. This means that whenever the child does not eat what you cook, you do not necessarily need to go into the kitchen and cook another meal. No, right? You just mention that this is the meal that you cook for today, and you can take your time, whether now or later you want to eat this food, right? So it is also a type of disciplines that you incorporate or instill during meal times, right? Other than that, other than these four main principles that I convey to the parents with picky eaters, other than that, I also share about feeding therapy, of which includes these three kind of therapy, which is shaping, positive reinforcement, and modeling, right? The second, the positive reinforcement and modeling therapy is more on changing the behavior or the situation or attitudes at mealtime. Whereas for the shaping, feeding therapy is more on those with history or food trauma. I had one patient coming to me, just drink the milk, yeah, and they exhibit, like a choking or gagging sensation whenever she look at the food. So how do we want to instill back that food is not harmful or that food is fun? Is through shaping processes, right? So how this shaping therapy is more to reduce the anxiety, and during this therapy, communication is essential, that you need to enforce or repeatedly convey the message that the food is not harmful, that feeding is not harmful, yeah, and it will not bring harm to you. Okay, it will obviously involve texture modification. If currently children is only achieving ataupun only receiving liquid as a form of food, yeah, we have to step accordingly, yeah, level by level, from liquid to semi-solid and then solid, right? And it could be conducted through flavor masking, right? Flavor masking is important if we want to introduce a new taste, a new food with new taste to the patient. We alter between the new food and the favorite food. Yep. And we can do this. I will share the flavor masking through food checking as well, right? The second one would be positive reinforcement. Yeah, positive reinforcement is more on the reward system. Yeah, meaning to say that whenever they eat certain food, they will be provided with reward. But this reward, mind you, yeah, the reward system, it should not be in terms of food. It should be in terms of other activities like games, opportunity to play games, do favorite activities, giving token or stickers. Why is it that we discourage the reward system in terms of food? Because it does not help in instilling ataupun providing a good behavior at mealtime, right? Other than the activities, it could be in form of social appreciation as well, like smiles, pat on the shoulder, any gesture. Yeah, some of the children, they really like the appreciation. We give more attention to them. Yeah, some of the feeding problems, if we look back into their history of development and how they eat, yeah. Attention to them, yeah, is essential, and when they achieve certain level or they achieve new achievements in their daily life, it is quite essential for the parents to give the social appreciation. Okay, and the last one would be modeling, meaning that they observe those parents, those people around them, including their parents, siblings, friends, and favorite anime or cartoon characters. So you can encourage them to eat new food by first, the parents should also eat, vegetables or things that they dislike, or the new food that you want to introduce to them. Yeah, and some of the children, yeah, they tend to eat more at their school, yeah, rather than at home. So because they have friends around them eating variety of food. So I think modeling is one of effective ways to instill ataupun to introduce new food to our children, right? And the last one would be food chaining. Okay, this is quite, I did this quite often for picky eaters, yeah, and it works. It really works, yeah. It's just that it needs an extra effort from the mother to try new recipe, to improvise the technique of food preparation. Yeah. So what is food chaining actually? So food chaining is the way you provide a diverse characters to the food. It's either, if you could see at the figure here on your right or left here, we can change the food. We have their favorite food, and we change it either the texture or we change in terms of the food groups. Okay, for example, currently the children are eating only chicken, or they are eating only kerepek, for example, kerepek, keropok, keropok ikan. So if we were to exchange, if we want to improve the food group accepted by these children, we will have to standardize, ataupun kita perlu, we will have to maintain the texture of the food, which is crispy. So other than the kerepek, yeah, we have to come up with different fried food, for example, like when we want to introduce, for example, chicken to them, we have to make sure it be in the fillet or very thin slices, and then we dip it in the flour and we fried it. Okay, so here we can change the food group, yeah. Either we can go with chicken, we can go with fish, yeah, but the texture has to be maintained, right? So one is we maintain on the texture, but we change on the food group, or the second one, we change on the texture, but we maintain on the food group. For example, they love to eat chicken, right? So okay, the first one would be the fried, and then we could go a bit down to the stir-fried chicken, and then we go a bit softer into the soups or anything with coconut milk, for instance, and then so you know, the variation of food preparation as well as the food presented to them will be altered already. Okay, right. So this is what we did with food chaining. So before we conduct this therapy, we will do some questioning on this part, like what is the parent's concern, yeah, and we will list out the number of food group in daily diet, like we did for diet diversity score, what is currently accepted, and what kind of food has been rejected from the children's diet. And we will need to list out their favorite food to become the core food, yeah, to be changed. And I also will ask about the successful mealtime. When is it appropriate? Maybe at the breakfast is last moody for the children, so better to start introducing a new food at breakfast or dinner or lunch. Yeah, so I will ask on that information as well. Okay. So on the left side here are some of the examples, yeah, of how we did food chaining. And whenever we did food chaining, how do we monitor, or how do we say it is progressive or not progressive? Okay, does it whenever the child ate the food is you know, the character of ataupun the attributes of a progression in food chaining? No, right? According to the Tommy and Ross, there are levels of food acceptance, yeah. So whenever we introduce a new food, if the presence of the food itself is acceptable to the children, they look at the food, they touch, they smell, they place the food at lips, yeah, they place to the teeth and make a bite. It's already not yet swallowing and not yet chewing. It's already a progress, yeah, because they can take the food into the mouth, right? So the second step, or the second hierarchy of food acceptance, is that when they take multiple bites, they hold the food in the mouth, not yet chew, or they chew a bit, but they spit, yeah, it's already a progress. Okay, when they chew and swallow, it's a success. Okay. And the higher success or higher hierarchy of food acceptance is that when they increase portion size. Okay, this time around they eat only like half cup of it, yeah, but the next time they achieve or they take up a whole lot of one or two exchange of that food. So these are the hierarchy, and each of us, the clinician as well as the caregiver, should understand this, right? So because when dealing with picky eaters, I have also listed a few points here. The first one be the patience. It has to be that, and we have to convey this message to the caregiver first. Whenever we're doing therapy or we did food chaining, patient and expectation should be clear, right? What should be expected in the therapy? You should expect that children will refuse it for the first time. So we have to make it clear with the caregiver, right? And during the session, it is best that the parents convey their expectation at mealtime. In this sense, communication is essential. What we expect them during the mealtime, and what are their expectations, how they feel about the food. Do you think you can take in this food? So the communication is also essential for both parties, right? The third one, the nutrition strategies for food chaining. Try one food at a time. You cannot mix or you cannot be rushed, trying two food at a time. No, it is not a good practice in that sense, because this is the time where the children explore the taste, the texture, the smell, and how it feels in their mouth. So, and the new food introduction should be repeated at least 10 to 15 times. Some of the literature mentioned that up to 20 times. Okay. So whenever a caregiver comes to you, they only try food for 2 times or 3 times, it's not enough, right? So we have to encourage them to try at least 10 to 15. It should not be, it can not always be in sequence or consequence manner. It could be like 3 days apart from the next introduction, or it can be 1 week interval between the next introduction, accordingly according to the children, right? To always practice responsive feeding, which relates more on the parenting style as well, like I mentioned before. And the last one, to eat with other family members as a source of encouragement. Picky eaters, if they do not have any sensory problem or cognitive problem, it more or less on their behavioral, right? So issues. So eat with family will somehow reduce that or overcome that problems. Okay. So I think I come to the end of my sharing session, that picky eating habits, in preschool children may determine development quality, physical activity, as well as general health status. So parents need information and feeding strategy to increase the number of food accepted by the toddlers, and appropriate dietary intervention to develop sound feeding solutions to address picky eating behaviors. And clinician can help to guide parents on the best approach to achieve better nutrition. And in my humble opinion, in order for us to tackle or work out on a plan for picky eaters, especially those with very selective level like autism, multidisciplinary team is the best option so far. Right, so we need to communicate among us what is the status, the current status of this children, and how do we, or how far should we push for new food introduction to this patient, right? So these are my reference, and I think that will be all from my presentation for today.
Thank you very much, Doctor, for very interesting talk. Okay, so we have two questions for our audience today. Okay, one's from Brother Hafwan from YouTube. Okay, does this assessment apply to adults as well? Apparently, the participant want to lose weight. Okay, and another question from EMK. Okay, child age 80 months not eating likes food for will only eat 5 soup max. Is he considered picky eater? Is buffet styling is not advised since he doesn't eat? Should we offer other food?
All right, so it's a good question. Like I mentioned before, yeah, when we did a diet diversity score, especially. Oh, the first question, is it applicable to the adult population? In terms of the nutrition assessment, we did this, our nutrition care process is similar to all, we did anthropometric, biochemical assessment, dietary assessment, but not so much on the feeding behavior on the adult. So the one that I mentioned, the questionnaire on the feeding behavior are only applicable for children. Right. Okay. And the second question from EMK is eating only 5 suap is considered picky. Before I came to that conclusion, I need to just remind you that when we did diet diversity score, we look into the numbers of food category as well as the portion. So meaning to say, if the children at less than the one exchange recommended to them, we would regard that as well as picky. Right? And if buffet styling is not advised, since he does not eat, should we offer other food? Okay. In that particular mealtime, yeah, it is advisable for you to just having that discipline, saying that at this mealtime, we will eat this food. Okay, right. So what happens if the children does not eat at all? Tak nak sentuh pun that food, kan? All right. So we can just ask them to, can you just touch the food? Can you just, take that one bite? If you don't want to eat that, it is okay. Yeah. But at this time, at this lunch, we only want to eat this. I have only cooked this one for the whole family. Right? So, kalau dia tak gerak juga, maksudnya dia tak ambil juga, kan? So we wait for like for 1 hour and then we introduce another. But at that instant ataupun at that time, kita offer many things. Okay, tak nak makan yang ni. And then kita pergi buat lain. At that meal time, it is not advisable. Right? So it's just that we want to instill that discipline in it.
Okay, Doctor. Another question from Sister Azhani. Okay, kalau bayi 8 bulan, supposed to be dah weaning since 6 bulan, tapi bila beri, baby tak nak makan langsung. Tapi bila try beri sekali lagi waktu malam sebelum bedtime, baru nak makan. Siang tak nak makan langsung, even kalau beri sebelum susu. Macam mana tu?
Okay, alright. So I have to juga understand, kan, the situation bila ibu beri makan tu. Is there any distraction to it? Ada toys berdekatan ke? Ataupun macam mana? Okay, so dia tak nak makan pagi tapi nak makan malam. Okay, so masa tu bagi makanan, kita kena tukar-tukar lah kita punya types of food tu. Okay, contoh kata kita bagi makan bubur yang mash, kan, yang yang lembut-lembut sikit, ya. So kita try pula the one yang the children boleh pegang and bila dia masuk mulut dia boleh melt sendiri. So kalau untuk yang awal-awal lah, ya, untuk umur 6 bulan, 7 bulan, macam tu, kan. Biasa kalau 6 bulan kita bagi yang pureed punya texture, yang lembut-lembut, that kind, kan. So contoh dia tak nak makan yang tu. Kita bagi one higher up texture, tapi benda tu kena safe lah, maksudnya bila dia makan tu dia boleh melt dalam mulut macam biskut ras gitu, kan. So kita try pula yang tu. So it is advisable for you to change the texture a bit. Kalau dia tak nak makan yang tu. Okay. So kita kena tengoklah pattern dia macam mana. Whether or not he accept or not. Okay.
Okay, Doctor. Thank you very much. And one last question from me. Okay, how about kids like 6 years old yang nak makan ayam goreng sahaja? Okay, that doesn't like vegetables or fruits, ayam goreng sahaja. Okay, how we tackle that?
Alright, so that is where the food chaining came in. Ya, maksudnya sekarang contoh dia suka ayam goreng, only ayam goreng. Okay, so the first one would be the shapes of ayam goreng. Yeah, it can be macam in terms of nugget, but we have to make it on our own lah. Yeah, ayam goreng bentuk yang macam nugget sikit, and then baru kita tukar dia punya dalam tu. Maksudnya kita tukar dia punya kind of protein. Either kita nak buat fillet of fish, dia suka yang goreng-goreng kan. So kita kena maintain the texture, but we modify the type of food yang kita introduce, whether or not from fish, ya, ataupun kita boleh lepas pada fish, kita boleh try tofu, ya, dip in the flour and then kita try bagi makan. Right, it takes quite a few steps kalau begitu. Ya, contoh saya lebih suka kalau contoh ayam goreng kan sekarang kan. So keduanya macam nugget punya style tu. Kita mince meat. Kita buat sendirilah. Saya tak syorkan beli yang nugget dah siap tu. So the mince in terms of different shape pula. And then baru kita upgrade kepada tukar pada protein yang jenis lain.
Thank you, Doctor. Very interesting talk. A lot of suggestion. Okay, I hope this new knowledge, okay, we learn a lot and try to apply in our life. Okay, again, thank you, Dr. Hazira. I would like to remind the participant to again register your attendance in iAttend. And for medical practitioner, please don't forget to fill in the Google form. The link has been given in the chat letter. Okay, if that's all, okay, I would like to end this session today with Tasbih Kafarah wa Surat Al-As. Thank you very much, Doctor. With that, I end with Wassalamualaikum warahmatullahi wabarakatuh.